What if I told you that the government can make you healthier just by making your bad habits more expensive? Sounds a bit manipulative, right? But here's the catch. It actually works. From cigarettes to alcohol to sugary drinks, sin taxes, special taxes on unhealthy products, are shaping the way people spend their money and in turn, shaping their health. But do they really work, or are they just a clever way for governments to make money off our vices? By the end of this video, you'll understand what sin taxes are and how they work, the surprising ways they impact public health, whether they truly benefit society or just create new problems. Let's dive in. What are sin taxes? A sin tax is a tax imposed on products or activities that are considered harmful to individuals and society. These typically include tobacco products, cigarettes, cigars, and vapes, alcohol, beer, wine, and spirits, sugary drinks, soda and energy drinks, gambling, casinos, lotteries, and betting, junk food. Some countries are now experimenting with taxes on fast food. The idea is simple. Make unhealthy products more expensive, and people will use them less. Governments justify these taxes by arguing that they reduce consumption, improve public health, and offset the healthcare costs associated with these products. Sounds logical, right? But does it actually work? How sin taxes affect public health? 1. Smoking rates drop significantly. One of the best documented successes of sin taxes is in tobacco control. Studies show that for every 10% increase in cigarette prices, smoking rates drop by about 4% among adults and 6% among teenagers. Why? Because price matters. Young people and low-income individuals, who are the most price-sensitive, are less likely to buy cigarettes when they become too expensive. This means fewer people develop lifelong smoking habits, leading to lower rates of lung cancer, heart disease, and respiratory issues. Countries like Australia and the UK have seen massive reductions in smoking rates thanks to high cigarette taxes. And it's not just smoking. Other unhealthy behaviors also respond to price increases. 2. Alcohol-related deaths decline. Alcohol-related diseases and accidents cost societies billions in medical expenses and lost productivity. But when alcohol prices go up, alcohol-related harm goes down. In Scotland, a minimum alcohol pricing law was introduced in 2018. The result? A 13% decrease in alcohol-related deaths within just 2 years. A drop in alcohol-related hospital admissions. It turns out, when people have to pay more for alcohol, they drink less or switch to lower-strength options. 3. The sugar tax, fighting obesity and diabetes. You know how some drinks seem too cheap to be true? Well, that's because sugar is heavily subsidized. But some governments are fighting back with sugar taxes. Countries like Mexico, the UK, and South Africa have introduced taxes on sugary drinks to combat obesity and diabetes. And guess what? It's working. Mexico saw a 7.6% drop in soda sales within the first year of its sugar tax. The UK forced brands to lower sugar content in their drinks to avoid the tax. In Philadelphia, US, sugary drink sales dropped 38% after a local soda tax was implemented. This is huge because excess sugar is linked to obesity, diabetes, and heart disease. By reducing sugar consumption, sin taxes can lead to a healthier population. Does sin tax actually work? The counter-arguments. Of course, not everyone supports sin taxes. Critics argue that they disproportionately affect low-income individuals. Since sin taxes make products more expensive, they hit lower-income people the hardest. Some argue that this is unfair, as it punishes people for their personal choices. They create black markets. When cigarettes become too expensive, some people turn to smuggling or counterfeit products, which can be even more dangerous. They don't always reduce consumption. And some addicted users will continue buying no matter the cost, leading to more financial strain instead of better health. So, are sin taxes just another way for governments to profit? Well, not exactly. Where does the money go? One of the strongest arguments in favor of sin taxes is that the revenue is often used to fund public health programs. In the Philippines, sin taxes on cigarettes helped expand universal healthcare coverage. In California, soda tax revenues fund school nutrition programs. In Finland, alcohol tax revenues go directly into addiction treatment centers. When used correctly, sin tax money doesn't just discourage bad habits, it actively improves public health services. So, should we support sin taxes? Let's break it down. Do they reduce consumption? Yes, especially for price-sensitive groups like teenagers. Do they improve public health? And The evidence says yes, smoking, alcohol abuse, and sugar consumption all decline when prices go up. Are they fair? That depends on whether the revenue is used for public benefit or just to fill government budgets. At the end of the day, sin taxes aren't perfect, but they are a proven tool for reducing unhealthy behaviors and funding healthcare. Final thoughts. Can money really change behavior? Think about this. If a pack of cigarettes cost $1, how many more people would smoke? If a Big Mac meal cost $2, how much more junk food would we eat? Money shapes behavior, whether we like it or not. And in the case of sin taxes, that influence can lead to healthier lives. Now, let's hear from you. Do you think sin taxes are fair? Or are they just a sneaky way to take more of our money? Drop your thoughts in the comments below. And if you found this video interesting, hit that like button and subscribe for more game-changing insights. Until next time, stay smart, stay healthy.